to it. What I expected from this bill, Mr. Speaker, was just the process. We should have simplified. You want to do an Harambe? Yes. Where do you go? You get a permit. But, Mr. Speaker, introducing a cabinet secretary, a CCM, audits, taxation, it's unnecessary. It is lethargy of the entire process, clogging the process. We should make the issue of doing an Harambe in this country to be very simple, where you just need a permit to do an Harambe. Give us a substantive reason. If it is a medical reason, let it be non-medical bills, Mr. Speaker. If it is some of the critical issues that the Gen Z raised during the protracted demonstrations across the country was the display of opulence by politicians, which was more dominant during public fundraisings than Harambe, Mr. Speaker. I think in the spirit of Harambe, at the building of this nation, and the senior youth representative, Senator Oburu Odinga, who is older than all of us, maybe tell us, is that, Mr. Speaker, the Harambe, as we used to know in the building of this country, went and changed over time, Mr. Speaker. We have done Harambes in many things, Mr. Speaker. I can see sometimes sports, we do Harambes. I see clubs doing Harambes, AFC, Leopard, Gor Mahia, and the rest. Mr. Speaker, and it comes to the attention of the House that national women amputee was stranded in Frankfurt, Germany, Mr. Speaker, after even winning number 4. So I don't know whether we need to fundraise for them, Mr. Speaker, and even videos doing rounds in social media, Mr. Speaker, is they are sleeping in very bad places as they remain stranded, Mr. Speaker. I hope something can be done, but of course somebody in charge there, that is his quality of performance. Mr. Speaker, the issue of charges, religious organizations, Mr. Speaker, has been, we normally every Sunday, maybe, I don't know, Mr. Speaker, what we should do to religious organizations, churches and mosques and other organizations, because they don't have direct money from anywhere, from either private or allocation from budget. And I think in future we might need to budget, Mr. Speaker, for the building of religious places, Mr. Speaker. Because even if today you are to deny Harambes to happen, Mr. Speaker, how will the church or how will the religious organization be able to fund the building of churches, the building of mosques, or any religious places of worship, Mr. Speaker? And I think we need to be very careful so that we don't overreach in this issue of regulating of financial rewards, Mr. Speaker. Because I think either the county government can budget for building of religious places of worship, or we can allocate from the national budget. In any case, 85% of national budget remains with the national and 15%, Mr. Speaker. Mr. Speaker, one of the common is the issue of hospital bills. I know every senator, including yourself, you are normally in WhatsApp groups trying to fundraise for somebody who is sick, Mr. Speaker, even on compassionate grounds, even including funeral expenses, Mr. Speaker. But I think one of the biggest challenge to many Kenyans is the hospital bill. We hope the social health insurance, the share issue, will be able to resolve, Mr. Speaker. And I hope with us contributing more towards the social health authority and the now transiting from NHIF to share, Mr. Speaker, will allow Kenyans to access medical care that they will not need to call for Harambes. Because every weekend, if it is not an Harambe for funeral expenses and medical expenses, it is for education. If it is not for education, Mr. Speaker, it is for building of places of worship, Mr. Speaker. So I hope and believe that the issue of hospital bill, if we are able to address the issue of fixing SHA and ensure that access to medical care is accessible to all Kenyans through universal health coverage, Mr. Speaker, we shall reduce by 80% contributions or Harambes that are done in support of hospital bills across the country. And the problem, Mr. Speaker, is not even the hospital bills. It is that we have commercialized medical services in this country. When you walk to a private facility, health center, they cannot explain to you as why they are charging, for example, the amount they are charging in their medical bills. I saw in some instances a private medical facility was charging 20 million on medical bill. When you ask them the gloves, the syringes, they cannot quantify or who gives them. I think the issue we should regulate the private health facilities across the country. Because no one can tell us whenever they give you an hospital bill. And I know, for example, like Moi Teaching and Referral Hospital, Jaramogi Oginga Hospital, Coast General Provincial Hospital, Nakuru, the Rift Valley, they have a way of doing waivers to the needy, Mr. Speaker, that is being done by. But these private facilities, you saw Beauty and Buy, that led to the botch of the late, may her soul rest, Lucy, who was buried the other day, Mr. Speaker, that you are being told that that facility is licensed. The allegations we are hearing is licensed to provide massage and masseuse services, but you are told they were doing some surgery for beauty issues, and it shows that there is a problem within the system, Mr. Speaker, and I hope at the end of it all, we should be able to address such issues of having. Even one of the major issues is compassionate donations, Mr. Speaker. We have seen, I remember in the last session, Mr. Speaker, some of us have been around for some time. In fact, and then the code, was it called a Coalition of Restoration of Democracy? When the teachers were on strike, they came up with a pay bill to fundraise for teachers then. Although no one told us what happened to that money that was being raised, Mr. Speaker. I hope with the audit coming under this bill, we will be able to know when such causes happen, Mr. Speaker. Mr. Speaker, I agree largely with the spirit of the bill, but I have reservations, Mr. Speaker, that, and you know, even in this issue of fundraising, Mr. Speaker, I have some reservations to it. What I expected from this bill, Mr. Speaker, was just the process. We should have simplified. You want to do an Arambe? Yes. Where do you go? You get a permit. But, Mr. Speaker, introducing a cabinet secretary, a CCM, audits, you know, taxation, you know, it's unnecessary. It is lethargy of the entire process, clogging the process. We should make the issue of doing an Arambe in this country to be very simple, where you just need a permit to do an Arambe. Give us a substantive reason. If it is a medical reason, let it be known, medical bills, Mr. Speaker. If it is about, Mr. Speaker, building a religious place, let it be known. If it is about compassionate grounds, let it be known, Mr. Speaker. And I don't see the need why involved. I thought the cabinet secretaries of this republic have better things to do than regulate Arambes, Mr. Speaker. I would have expected that we would just given a law that we give even through a law that provides, Mr. Speaker, for that appeals. On the issue of appeals, Mr. Speaker, I'll clear there's public fundraising bills. You remember when there was a ravaging drought and there were issue of anger in the country, Mr. Speaker. You remember Kenyans for Kenyans that was being done to fundraise for Kenyans. I agree that such, Mr. Speaker, we can say on public fundraising appeals, we do audit. I don't know whether Morara'S, who is fundraising to go and audit for fuel and working around with security, I don't know whether Morara'S, the proponent of inject, is part of public fundraising appeals. Because when you fundraise to fuel your car, to do something, I don't know whether it is part of the public fundraising. And I agree, there must be standards as to such, Mr. Speaker. I don't know, public fundraising involves also fundraising for campaigns. I have not seen in this bill, Mr. Speaker. Although we have campaigning finance laws in this country, but this public, I think we should have just regulated in terms of auditing. Let us regulate to public fundraising appeals. We don't create bureaucracy. You can imagine some small village somewhere in Nandi. I've lost someone. Their target to bury an individual is 250,000 shillings. Why create a bureaucracy for them to look for a chief, to go and look for CCM of sijui what, or a cabinet secretary to get an approval to fundraise for 250,000 shillings? Why don't you bring a standardized form for just permit to request to do an election, to do a fundraiser? And they should start it with the lowest person there, Mr. Speaker, that is Mzee wa Mitaa. The lowest person, just get approval from the local chief. How many in Machakos, how many people in that small village know of CCM or know of even Waziri or even sub-county administrator? I think, Mr. Speaker, it's very unfortunate that we want to do. Mr. Speaker, I don't see anything that receive, vet, and process applications. Let me walk to the chief's office with a permit to do an Arambe, let the chief look at it, and then I'm allowed to do an Arambe. But to public fundraising appeals like for the food, that one you can do the vetting and approval. But on this one, sir, private, Mr. Speaker, I don't see any need. Even the audit, Investigate misuse of funds. I agree. These are issues that can be done in public. Establishment of endowment funds, which is important. I know, like Ratansi and other endowment funds who support Mr. Speaker. Mr. Speaker, even on the role of Cabinet Secretary and County Executive Committee member, Mr. Speaker, inspection of records. Mr. Speaker, there are many better things that the CCM and a Cabinet Secretary can do, rather than, Mr. Speaker, doing regulating Harambes. Let us also be fair to this country. Let us prepare laws that are fair to the Kenyans, Mr. Speaker. No one is refusing. Harambee is good. Some of us, like me, Mr. Speaker, are product of Harambes. If I didn't get Harambee support, Mr. Speaker, maybe I will not be a senator, because even going through my schooling education, a number of us in this house. So let us not lose the real and noble intentions of Harambee. We agree individuals have hijacked Harambes to launder their money. You are seeing cases where people are contributing 5 million shillings cash, 10 million shilling cash, and their salaries are known. Somebody is earning 500,000 after tax, 300,000, and they take loan maybe through what we call mortgage, Mr. Speaker. How can somebody contribute 5 million in Harambee, and yet we know your salary, we know your cows, we know where what you do? Mr. Speaker, I agree. There was a problem where Harambes were being used to launder public money. But, Mr. Speaker, we should not kill the spirit of the Harambee. Harambee is good, and I've said, Mr. Speaker, for us who grew up in the village, it is because of Harambes that we went to schools. It is because of Harambee that kettle dips were being built. It is because of Harambee that we have good places of worship, Mr. Speaker. Mr. Speaker, at the end of the day. So let us not lose that good intention. Mr. Speaker, solicitation members or public for public or private benefit, I agree, Mr. Speaker. I know people who do fundraising, Mr. Speaker, for their own selfish benefit. We must root out such individuals. If you do an Harambee, it should be something. We don't want also Kenyans, Mr. Speaker, to do an Harambee to buy a vehicle or to build a personal house or to buy a good suit. We must agree that Harambes are important, Mr. Speaker. They assist in alleviating economic burdens, Mr. Speaker. Mr. Speaker, I think on regulation, I have insisted that let us know the target. In fact, Mr. Speaker, I'm proposing a committee of the whole. When an Harambee is being done, before a permit is issued, Mr. Speaker, if a target is beyond 1 million, let us say you need a permit from target of 1 million.